Good morning, everyone. Gosh, it's such a pleasure to have so many of you here with us this morning at the Sloane Club. It's such a beautiful space as well. Even though the sun's not shining, it's just amazing to be in this light-filled room, and especially on such an important day, World Mental Health Day. I'm Francesca Okiman-White, and I'm the founder of the Beauty Triangle. So this morning, in support of World Mental Health Day, we're going to be looking at how to gain inner strength, in whatever form that might shape for us. For some of us, it's going to be about having skin that bounces back and that weathers life's ups and downs. For others, it might be about building a body that stands the test of time and that feels resilient inside and out. Then there are those of us who want to look inward and perhaps learn a little more about how to cultivate greater mental health, a more robust nervous system, and a sharper sense of mind. Now, when we launched the Beauty Triangle, it was to educate and empower our audiences on all aspects of their health and well-being, and always critically from a holistic standpoint, which is why you'll always find 3 speakers on our panel, each of whom is an absolute expert in their given field of authority. But we also wanted to have those conversations that were going a little bit more unspoken in the world of wellness, and in doing so, connect you with the most trusted practitioners whose advice we take on board and who we'd love to introduce you to as well. Brings me neatly on to this morning's excellent panel. We're joined by celebrity facialist and founder of the Kinesis Clinic, Sarah Chapman, aesthetic doctor and regenerative specialist at Harrods Wellness Clinic, Dr. Marwa Ali, and founder of the Human Method somatic movement coach, Necessitate Belgeonne. And together we're really going to be exploring how to fortify skin, mind, and body, from the power of clinical grade skincare and the power of touch, through to some really pioneering practices and treatments which can help to restore cognitive function and sharpen the mind as we embrace the road ahead. Now, hopefully you should have all have found a program on your seat so you can find out a little bit more about our speakers. There's also a referral card there, so if you'd like us to connect you with anyone that you hear speak this morning, just leave your name and email, tick the box next to their name, and we'll connect you afterwards. We'll have time for some audience questions at the very end, so please do hold on to those until then. And finally, last but not least, we have an amazing goodie bag for everybody here with the brilliant R&R cream, courtesy of Sarah Chapman Clinical. So please don't leave without one of those. It's exactly what your skin barrier needs at this time of year. That's enough from me. I'm going to hand over to our speakers. They're going to say a very quick hello, and then we'll get started with the main conversation. Sarah, thanks for joining us.
Thank you. Wonderful to be here on such a special day, and lovely to see you all and be here in this fabulous new club, which is gorgeous. So I'm going to be talking about inner strength from a skincare perspective. So tapping into things like ingredients and what we do to support the strength of our skin before we get sort of the complementary sort of comments from everybody else in terms of inner strength. So it's really great to be here, and I'm really happy to answer any questions that anybody has afterwards, even if it's just personally about your particular skin concerns.
One-to-one skincare consultations with you will be highly in demand, I think. Marwa.
Hi, my name is Dr. Marwa Ali, and I'm an aesthetic doctor based at the Wellness Clinic in Harrods. It's my first time here at the Beauty Triangle, and it's a pleasure to be here. And I think I'm here to talk about my approach to aesthetics to help improve people's confidence and to look after their skin health as well as mental health and how they're all connected.
Hi, I'm necessitate Belgeonne, and I'm a somatic movement educator. And I specialise in burnout and chronic anxiety and stress and trauma issues. So psychotherapists often refer their clients to me where talking therapies has reached its natural conclusion. So my ethos is that I don't believe that you can think your way out of a feeling state. And so that's why I kind of went in, quite deeply into the nervous system. And just before this, I used to have studios in central London called Good Vibes. And it was yoga and Pilates and fitness. And I realised that there was lots of people who needed this work. So I went in quite deep into nervous system. And I mainly work online, but also retreats. And feel free to ask me any questions afterwards as well.
Amazing. Oh my goodness, that's suddenly very loud. Oh wow, okay, I can hold the microphone back a little bit. So everyone's introduced themselves, and I'm so excited to be joined by such a powerhouse trio of women up here this morning. We'll start with Sarah. Tell me, Sarah, what are the things that cause the most anxiety when it comes to the clients that you see surrounding their skin?
I think it's massively varied now. If you'd asked me that question some years ago, it would probably be more focused on acne and breakout skin, and we would see people coming in and really losing their confidence and feeling really almost like they wanted to sort of hide themselves because of acne. We still see some of that, but I think I see much more in terms of people coming in and just saying, I look really tired. Nothing I do seems to make a difference. How can you make me look really well? How can you make me look like I've had a brilliant 8 hours sleep? How do I get that glow back to the skin?
And so much of that comes down to skin quality, doesn't it?
Yes, and just sort of the general balance of the skin, how you're doing your skincare, but also how you're living your life. But we also have seen a lot in terms of a rise in rosacea, redness, sensitivity. Over the last few years, perioral dermatitis, which has risen massively.
That's been a huge one. I have so many friends who have been complaining about perioral dermatitis. I mean, what is it exactly?
It's like a reaction, and you see it round the mouth area. Literally, it sort of sits here. And often people will come in for a facial and say, I always am really dry and red around my mouth, but they don't realize it's actually really a medical condition. And we have a team of dermatologists as well in clinic, so we can then refer on our clients from facials to see the dermatologist to treat specific conditions like that, because it may need a topical prescription in order to actually get rid of it. But quite often these things are induced by stress, but it can start with triggering your own skin by overusing products, misuse of active ingredients, and disrupting your skin barrier. And then potentially you might get some bacteria in, and it sets off this cycle where the skin is just not strong and resilient.
100%. There's that sort of snowball effect of all of those things sort of compounding upon one another. And it's interesting you mentioned the skin barrier, and I think that's such a big topic of conversation right now. Why is it so important that we strengthen that skin barrier, and what are the ways that we can all look to do so ourselves?
Well, skin barrier it has become a real topic of conversation, hasn't it? Our skin is obviously our biggest organ. It's covering us. It's what everybody sees. We want it to look its best. We want it to perform its best. It's not just about looking smooth without lines and good skin. It's your sort of representation of how you feel on the inside. We always say your skin is a barometer of your internal health, so everything is connected. And we have seen this rise in sort of barrier dysfunction where people have either used the wrong sorts of products or overloaded products. Generally, sort of clients and consumers have become so much more aware about ingredients. We know about retinols, niacinamide, vitamin C, acids. So do we need to put it all on, and do we need to do it every day? No. And I think that's sort of what started to happen. So in clinic, we were seeing more and more and more people coming in where they literally couldn't put something really simple on their face anymore without it stinging, without it burning. So we developed a treatment actually last year, a barrier repair facial, where we even went into the medical field and we found masks that are used for third-degree burns, and we kind of brought them into this clinical treatment so that we can take down the inflammation. And we also, the product that you're going to take home today was developed specifically for supporting that barrier and the barrier function. And I think that it's really important that you don't over-treat your skin. You treat your skin with sort of intelligence and intention, not punishment. The skin is an organ. It's kind of living and breathing. Your cells are working. There's a lot of activity that goes on in your skin. So you should kind of protect that. And if you protect your barrier, then your skin's going to look much better as well.
Absolutely. And I think we've definitely moved away from this very sort of aggressive approach to skincare as well. I'd love to touch on the topical things that we were speaking about just then, things like the retinols, the vitamin C's, the acids, because obviously in the right hands and in the right concentrations and with the right delivery systems, these can get incredible results on our skin, can't they? But how do you go about sort of not overusing them? Take something like retinols, which we can have a love or hate relationship with. What is the best way to use them, and should we all be using them? Are they suitable for all of us?
Yeah, I mean, retinols I love. I'm in love, not a hater. Well, firstly, one really simple thing I would say is if you get a product, follow the instructions. Because actually they've been worked out because that's how the product is going to work its best for you. And I know I deal with clients every day. we don't read the box, we don't read the instructions. But actually they've been carefully written because the product has been tested to perform in the right way if you use them like that. Retinols are actually, well, retinol is a form of vitamin A, and actually there are quite a few different forms of vitamin A. So if you see retinol palmitate, it's an oil lipid form of vitamin A, and it's probably the gentlest on the skin. So if you are worried about using a retinol, you can start with retinol palmitate. Retinol is the alcohol form, that's what the ol piece is. You have retinal, which is retinaldehyde, and then you have in your skin a natural retinoic acid, and every one of those other forms of retinoid get converted to retinoic acid in your skin, and that's what actually gives you the improvement. And it probably is the gold standard ingredient. Everybody can use a retinoid, it's just about how you use it. And the best way is to sort of introduce it maybe every 3 days, say twice a week, and then build up to using it every day. That's the slow approach that will give you much less reaction.
And I suppose in conjunction with that, it's then sort of making sure you're partnering it with the other skincare products that can really restore skin barrier health and really sort of bring that hydration and that comfort back to the skin as well.
Yeah, I think in everything that we've always done, we've considered how to support the skin while we're treating it if we want something to get a good result. So I'm a very big fan of omega supplements, but also omega oils in skincare because they're super anti-inflammatory. They help to really support the cell membranes of the skin. So if you're treating with a retinoid or even an intensive vitamin C or an acid, but you're also supporting the skin with these anti-inflammatory ingredients, with skin support for your cell membranes, you can actually work with those ingredients much better with your skin and reduce the downtime of reactions. The other thing to look for now, which is becoming much better, is delivery systems in skincare. So
you've got a really interesting one in your Power A serum, right? Which is all about sort of how you deliver that retinol to the skin.
Yeah, because we were looking for a way to get high concentrations of retinoids down into the sort of cellular level in the skin without these reactions of redness, peeling, sensitivity. So we worked with a pharmaceutical company in Europe who had developed a drug delivery system in the medical space. And so the retinol and retinol are encapsulated in this delivery system, which has been clinically proven not to release any of it on the surface of the skin. So it bypasses that, gets down, gets released to the cells, and that's where you're going to get the result on the skin.
You explained it to me once like an elevator. It sort of goes from the ground floor all the way down to the basement without stopping in between and sort of delivers it right where it needs to get to.
Exactly. And what happens with a traditional formulation, and we use those as well, is the elevator stops on every floor and releases a bit. So by the time it gets down to the cells where you need it, there's only one passenger left. The others are all up here somewhere, which is great.
With
they're
really
doing a little bit up
skin.
here, but that's why they're building up in the surface and you're getting a reaction. What you want is all of them to kind of get out at the bottom and powerhouse that response for your skin. So delivery systems are really key to look for. Vitamin C you mentioned as well. Vitamin C ingredients are brilliant for brightening, radiance, but also collagen production and also strengthening capillary walls, so they'll help with redness and sensitivity. And I think you just have to learn to understand your skin a little bit and just be sort of intelligent about your approach and gentle with your approach.
I have to say I love your vitamin C serum. It's the only thing keeping my pigmentation under control at the moment. It's a real sort of game changer in brightening. I love that you touched on omegas as well, because obviously we know that they have countless skin benefits, but they're also so fundamental for brain health, for sort of mood regulation, hormonal regulation. How do you sort of incorporate that? Are you sort of taking them yourself in supplement form, or do you think it's enough to get them through our skincare?
No, I think supplementation is key with them as well. And you're absolutely right. Omegas, if there was one supplement that I took, it would be an omega. I think I've taken them for 20-something years. I personally use a range called Bare Biology, which do really high-quality fish oils. And we use those and we recommend them in clinic. If you're somebody that has kind of eczema-prone, dermatitis-prone skin, sensitivities, omegas are an absolute must taken as a supplement. But also look for omega-based oils in skincare. You can get them in quite a lot of the kind of really high-quality plant oils so that you're doing topical and internal application as well, because that's how you get the sort of best results.
Sorry, I was going to say, let's also talk about the power of touch, because I think what's so incredible about your facials is that they sort of bring together all of your amazing knowledge about the skin, what it needs, the topical ingredients, but they also have that sort of extra level of sort of touch and sort of comfort. And why is that so important to you, would you say? And why is it so fundamental when we're trying to boost self-esteem?
I think it's so important. I think one of the things that we always say is that we look after you and your skin. So it's not just looking at your skin as a separate thing and saying, right, we're going to put this, this, and this on it to get you better. Sometimes we'll talk to somebody and they think that they want to have some microneedling and laser and all this, but actually in the consultation and talking to them, we know they just need a really good facial massage and some touch and some downtime and some pause. So there is so much in skincare that isn't just about changing the structure of the skin or the pores or the lines or the pigmentation.
It's actually responding to that patient in front of you and what they need on a more emotional level as well as on a topical skincare level.
Yeah, and I think we all know that if your skin feels or looks bad, you lose your confidence. We really believe that we are working to kind of transform your skin health and also to bring you confidence from the outside in. So we're going to work to make you feel better and deal with the psychological and the physiological aspects of skincare. So the reason that when you use my products, you get this amazing feel-good factor, because actually we've used essential oils, which we know are psychologically going to make you feel better. The textures are really beautiful. So every time you use something, you almost feel like you're in that treatment room, and that makes you feel better, and that makes you psychologically feel uplifted or relaxed depending on what you're needing. And at the same time, the physiological change in your skin will come from peptides and stem cells and vitamin A and antioxidants.
It's sort of fusing that sensorial experience with the science-backed solutions of the ingredients that you really need to get. And I think you're so right, that's what's gone into your products, and that's what's so wonderful when you do get to come into the Skinesis clinic and have a treatment there. It's interesting because you spoke about obviously sort of being able to use products in a way that do give you that mood boost and that feel-good factor. Do you have any application tips or anything that we could all be doing at home to actually really enhance that self of ritual and stability through our skincare?
Yeah, I think it's always taking a moment to breathe, which seems like such a simple thing, but how often are we just like
I'm deep breathing now as soon as you say that.
Yeah, it's like everybody just take a breath, and if you even just take a few breaths, suddenly you feel in a different space because you're working on the whole system. And we do that with the products because they all have such amazing smells, and they are potent kind of essential oils, so they have the ability to really change how you feel. If you take your cleanser, for example, and you just stop and give yourself the moment. Don't just stick it on, wash it off, and then you're done. Breathe it in, inhale, and massage, because massage, even if you're doing massage for yourself, is so powerful to make you feel good. It's that power of touch.
Absolutely.
It's great if you can go to somebody else, but if every day at home you actually take that time to really nurture yourself, psychologically you also feel so much better.
It's giving yourself a hug in a way, isn't it? And it's so good sort of on a physiological level for the skin as well to be massaging the face properly, really getting the circulation going, really draining the puffiness and brightening the complexion.
Yeah, even if you've got something simple on your face, if you do that, you absolutely will see the difference. You bring that blood flow, you're feeding every cell with oxygen and nutrients, you're helping to drain away toxins and sort of the cellular debris, getting that out, and your skin's going to be sort of more radiant and looking healthier as well, but also working in a better way because you're helping it to perform. But that sort of power of touch, the power of smell, no matter what products that you're sort of using, will help you to kind of feel better, whether it's a morning or an evening routine.
And you gave me a really good tip once, which I love, and it's to cleanse your face as soon as you get home at the end of the day, which is so interesting because for most of us, I think we sort of think about doing it just before we go to bed, if we remember. And then it's a sort of quick, how quickly can I do this, and then sort of hit the pillow. Why is it so important, rather, that we sort of try and do that as soon as we get home at the end of the day?
This is something that I've probably recommended to thousands of people over the years. I have heard so many times, obviously in clinic, where people say, oh, sometimes I just can't be bothered to cleanse my face by the time I go to bed because I'm exhausted. Or, yes, I do it, but quite often I forget. And I say, just try this for a while. And when you get home, do you change from your work clothes into something else, etc.? At that point is when you do your evening routine. So it could be 6 o'clock in the evening, could be 7 o'clock in the evening. It's before you have your dinner. And you give yourself that ritualistic moment where you cleanse really well, you massage really well, you wash off the day, and actually, really interestingly, you psychologically take the day away. So
I think it reframes
stress,
your mind, doesn't it? You know, you forget everything that's been sort of bothering you during the day-to-day and the work and the
it's
emails.
almost down the drain and gone.
And then
It's
you
like
you start the evening on a clean slate.
and you feel positive because you've done it. Because we all kick ourselves if we don't cleanse or do something else. So you feel positive, but also you're clean and you've done your routine. By the time you go to bed, you haven't got to think about it. Just brush your teeth.
And you know,
go.
especially at this time of year, because I often think as soon as the clocks go, what is it, back that they're going? Back or forwards?
Yes, full
Whichever,
backwards, isn't it?
whatever
Yeah,
happens soon that makes it very sort of dark in the evenings. We often sort of forget that we have an evening, don't we? Whereas in the summer, you know, you finish work at 5, 6 o'clock and you have the whole day, it feels like, stretching out ahead of you. Whereas I think to start your evening on that note and then go, I've still got a few hours.
Yes.
How am I going to sort of take this time for myself is really empowering, isn't it?
Yeah, and I think everybody, no matter kind of what you do, has a busy life. Whatever it is that's in your day keeps you really busy. So I do think that those little moments make a massive difference to how you kind of feel about yourself and how you feel about life. And I think having that antidote to a sort of stressful day, and actually I've just done something that's purely for myself, but it's not a selfish thing. It's a good thing to do, and I think that makes people feel good. And of course, it's hugely beneficial for your skin because you're giving your skin a really good cleanse. You've got rid of pollution, dirt, grime, makeup that's left from the day, and you're allowing your night products to have that real time to absorb before you go to bed.
And I think sleep is such a powerful part of all of this, isn't it? Skincare and making sure that you're feeling rested and sort of rejuvenated. And I always love this story. I think I told you, a colleague of mine years ago saw Sarah for a facial, and I think she was a new mother, and she said that she had the most amazing facial with you, and then she fell asleep during it. And then you just left her to sleep on the treatment table for an hour, which I
must have had a
absolutely
lunch break
love.
or something.
But she's raved about you, for 15 years
That was
since.
in my first treatment room.
Yeah, back on Draycott Avenue. But how special is that? Because I think that really emphasises your point about it's not just about what we put on the skin. It's about responding to what the person, the human being in front of you actually needs in that moment in time.
Yeah.
And that might be sleep.
And we do offer very bespoke treatments. So we do that consultation process. And like I sort of touched on earlier, you could be coming in and thinking that you've read about some specific treatment that you want to have, but actually we realize when we talk to you that you're exhausted or stressed or going through something, that actually if we just do a really good facial, but we do it very much hands-on, that you're going to leave feeling like a different person. And I had somebody in recently who never has time to look after herself. She's super busy. She's got an amazing job. And she virtually cried at reception afterwards. And with her, I didn't use any machines because I just thought she just needs to have a little bit of hands-on TLC, but also her skin was very tired and it needed to be transformed. And we did that with lots of massage and some treatment like that. So it's about, I think, always thinking about yourself from maybe a slightly different perspective. And I think in skincare, don't read everything and think, I've got to have that or I've got to have that, because actually not everything is relevant to everybody at every time. And it might be in 6 months that treatment's really good for you. But at this time, actually, psychologically, you need more support.
It's cultivating that sort of self-awareness, isn't it? And also being in partnership with somebody who knows skin inside and out, which I think you do by the sounds of it.
And I think also, smell, we talk about the power of smell, don't we? And that actually, there is a physiological thing that happens when you smell. It goes through to the hypothalamus in your brain, it triggers the limbic system. That then has a massive effect. And that's why if you take that little moment to smell something with essential oils in, that really good sort of fragrance, there will be some change that actually really happens within your mind and in your body, even though you've only taken a moment to do it.
That's the thing, it can only be a moment sometimes that's all we need just to switch out into that better sort of mental state. Amazing. Thank you so much, Sarah. That was fascinating as always.
Thank you.
Our next speaker is Dr. Marwa Ali. She's renowned for doing some very beautiful, undetectable work from the Harrods Wellness Clinic when it comes to all things aesthetics and regenerative aesthetics. Marwa, tell us a little bit more. You're known for having a very light touch with your aesthetics. Is that something that patients are looking for at the moment? And what else is bringing them to your door?
So I think the whole world of aesthetics has had a major shift. Previously, people associated aesthetic medicine as this very overdone look that we see in Hollywood. But now we're moving towards a more natural looking appearance, a well-rested appearance. I'm echoing what you've just said. for you to look really well rested and refreshed, like you've had a good night's sleep or you've just come back from a wellness retreat. And I think way back when I started in aesthetic medicine, I was educating people at the importance of maintaining your actual identity and just looking like the best version of yourself. And
so
I think everyone's
lose.
now catching up with that and is adopting that method right now.
And how are you doing that? Because I think that's really pivotal, that idea of identity, and especially in an era now which is rife with comparisons and social media and filtering. How do you work with the patient to help them identify what is unique to them and to celebrate that, whether that's their age, their culture, or their ethnicity, for example?
I think it all starts off with the consultation process. So having a moment to sit down and actually discuss what it is that the patient actually wants to achieve and what their goals are, and to see whether we can achieve those goals by maintaining their identity, whether it be cultural or whatever it is that they're trying to seek, and to try and enhance that and give them a result that they are satisfied with, so that they feel more confident in themselves, as well as maintaining who they truly are and celebrating that.
I think you're so right. And actually what's so interesting is the amount of time that probably takes as well. And it's that time that we don't often give ourselves to really sort of take a deep dive and go sort of deeper than the skin to think about, how do I really feel and how do I really want to feel as a result of having this treatment? How often do you see someone's facial aesthetic, their body image, playing a very big role in self-esteem? I mean, you see women and men come through your door countless times a day for all various reasons. Is self-esteem really a driving factor in people coming to seek you out?
I think it definitely, self-esteem is a major component as to why someone would go to an aesthetic doctor. Like we said before, your skin is your largest organ. It's the first thing that someone sees. It's your canvas. It's what people will judge straight away when they first see you. Then you've also got like all the pressures from society on self-image and trying to maintain that. Also, you know, from a longevity perspective, trying to live longer, look younger, feel better. So we're thinking about, you know, from a complete 360 approach, you want to tackle all of those things. And also you're trying to live, like, as I said before, trying to live longer, try to look younger, but you also want your mental health to catch up and also be as optimal as possible, as we are starting to now shift towards living longer and maintaining all of those things altogether.
It's interesting, and even sort of working longer as well. You often hear sort of women saying, you know, they want to continue to feel, I suppose, relevant in a professional sense as well. You know, we're striving to live longer, have careers longer, we're having families later. And sometimes it feels that our aesthetic isn't quite in the same, it doesn't match often how we feel on the inside, does it?
I mean, I think now we are able to match up with that, you know.
We've
got all of the different tools now in our toolbox so that we can achieve those things non-surgically and regenerate the skin. We're now looking at things that boost collagen, because as we know, from the age of 20 onwards, those levels are slowly declining. And then we have that accelerated time of collagen loss, you know, perimenopausal and also just after we reach the menopause.
It's that 30% sort of collagen production sort of decrease, isn't it, when you hit menopause?
I mean, at the age of 50, you lose 50% of your body's ability to produce collagen naturally, which is why we need those extra little bits of help, you know, with skincare as well as, you know, non-invasive devices to boost collagen and also hydrate your skin, replace hyaluronic acid that seems to, you know, decline with age, and to boost collagen production as much as possible.
I mean, collagen stimulation is such a buzzword now in the work that you do. What are the different ways that you're able to achieve that? Because, I mean, you can use devices, you can use injectables, we can use skincare as we discussed with Sarah, but what's your sort of go-to?
So I think medical grade skincare, you know, to boost collagen, like with vitamin C, with retinols and things like that. In addition to that, we've got injectables like polynucleotides, which is a real buzz. I mean, now people are talking about salmon sperm facial, but we've been using it as an injectable for about 5 years, I'd guess.
And its sort of origins run so much deeper. It's sort of been around for like 30 years, I think, hasn't it, in terms of like physiotherapy and joint support.
And so it's anti-inflammatory, it boosts collagen production, it increases the blood circulation, it works on different levels of the skin, I mean, skin, muscle, fat, all down to the bone to regenerate the skin. We're also seeing a rise in the production of other newer products, such as new generation polyl-lactic acids like Gelane, which work in a completely different way to traditional older polyl-lactic acids to literally regenerate your skin, to reduce the inflammation in your skin, reduce pigmentation, increase collagen, and maintain your actual identity, but just make you look fresher and younger.
So this is an injectable product, but it won't add volume. It's not like a hyaluronic acid filler. It's actually just there to sort of give your skin the support it needs to regenerate naturally, I guess.
Yeah, and then beyond that, there are energy-based devices, such as HIFU, then there's microneedling radiofrequency, then there are lasers, which all play a very crucial role in maintaining the way you look, but just boosting collagen production, lifting and tightening, all non-surgically. And it's really remarkable, actually, when you take the time and invest in your skincare and your facial aesthetics, how much younger you can look without having to go under the knife.
Yes, exactly. And I think there have been amazing advancements. And this isn't just, the face either, is it? Oh, microphone's gone. Oh, no, it's back. You can also apply a lot of these treatments to the body, a lot of the collagen stimulators, a lot of the energy-based devices. Tell us sort of about the body and sort of where you see it having the greatest impact on someone's self-confidence.
So like we said before, our skin is our largest organ. So virtually, do you remember when, I think there was a time when you and I were at another panel, which was at an actual aesthetic conference, where we were talking about simple things like Profilo. And I had been
using... Which was game-changing at the time.
Yes, exactly. And I had been using Profilo on the body way before they started making a specific injectable, which was designed for the body. It's called Profilo Body, but it literally has the same components, and it's just a larger syringe. But just applying those same principles that we apply to our face to the rest of our body, lasers can be used to remove stretch marks or improve the appearance of stretch marks, because obviously there are different degrees of scarring, etc. And obviously everyone's body will respond to different treatments differently, but we can use that toolkit to apply also to the body to address a whole host of different concerns, whether it's surgical or non-surgical scarring, whether it's pigmentation on the body, whether it's tightening different parts of your body post-partum, or even post-weight loss, even injectables, like I said before, Profilo, polynucleotides, polyl-lactic acids to tighten, lift, and contour the body. We've got quite a lot of things up our sleeve.
I think especially given the rise of weight loss medications as well, these sort of body-focused treatments are really going to start taking off in a big way, aren't they?
Yeah, they already have.
Yeah, exactly. Yeah. Tell us a little bit about acne, because I know that's something that you also do a lot of work in, and obviously acne affects the skin on the face, but it also can spread to the body, back, shoulders, and that can be really crippling for someone's self-confidence. How are you going about treating that now, and how in doing so can you restore confidence to that patient?
So even the way that we approach treating acne has changed and shifted amongst in the last few years. Obviously, using medical grade skincare is still a staple in treating and combating acne, using salicylic acids, retinols, tretinoins, etc. Medical grade, so prescriptions, not prescription skincare, prescriptive medication like Roaccutane is a huge part of combating, especially like skincare resistant acne. But now there is something like lasers specific to target acne, like Aviclear, which is basically a patented diode laser that targets the sebaceous gland, targets the oil to reduce the activity of the sebaceous gland and not completely render it inactive, but reduce the production of acne so that it reduces, blockages in the pores, reduces the inflammation, and basically treat acne. And it's a great way to treat acne without having to have the commitment of taking a pill every single day that might have other side effects on your body and take its toll, like increasing cholesterol, the effects it has on your mental health, the effects it has on your skincare, cracked lips, dry hair, etc.
Difficulty with Roaccutane, hasn't it? That people think,
is it going to compromise my mental health?
Yeah.
But at the same time, having breakouts and having acne that is so persistent you can't shift it, that is also incredibly detrimental to your mental health. So you don't want to forego one for the other, because obviously if you don't treat the acne, it can lead to scarring down the line, which also has knock-on effects on self-confidence. So tell me a little bit about the AviClear and how many sessions you need to actually see those results.
So with the course of AviClear, we typically treat a patient 3 times, 1 month apart. It's literally an hour session. There's no downtime. You're able to go about your day-to-day life as usual. You come back after a month, do it again, and then again after 1 month. So you have 3 sessions in total over the course of 3 months. You don't have any other side effects that, like we just discussed before, hair loss, mental health issues, etc. And it's so effective. And in fact, I find in my practice that it's as effective as taking a 6-month course of Roaccutane.
That's incredible.
It gives you long-term results. Sometimes, occasionally, a patient may need a top-up of a treatment once every 1 or 2 years, but the results of it are staggering and it's incredible. And I just find that it makes my job feel so wonderful. I get that job satisfaction when I know that I'm helping improve someone's self-esteem and their confidence through what we do. Obviously, acne is just a very small portion of everything that we do treat, but but acne is a major issue that affects people from all different age groups and people from all different walks of life. And you were asking me just a second ago about what we do with these side effects of having, there are other things that happen to you after you have acne. You've got the scarring. You've got the scarring, you've got the pigmentation, you've got the redness that may persist, and doing things like lasers to help smooth out the skin, reduce the scarring, reduce the pigmentation and the redness, combination therapy with injectables like polynucleotides and polyallactic acids to literally restore your skin health and make it really nice and smooth and lifted, have been amazing.
Yeah, it's such a game changer in terms of self-confidence, being able to control every sort of part of that journey. And tell us a little bit about sort of how you bring mental health into this as well, because I think sadly the aesthetics industry, much as I think it has such a powerful effect on our self-esteem, it's sometimes tainted with a little bit of a sense of superficiality. So how are we bringing the world of mental health into aesthetics, and how can you support someone's self-esteem in addition to doing all of these skin-enhancing injectables and energy-based devices?
So I've been very fortunate enough to be one of the first clinics in the UK to bring in a device called ExoMind, which is a treatment that utilizes TMS technology, which has been around for about 40 years to treat a whole host of different mental health issues. Now ExoMind, actually, to be honest with you, on my own journey of TMS, I was first introduced to the idea of TMS about a couple of years ago by a friend who's a psychiatrist, who asked me to go into a whole different business thing with her where we'd be treating people for, mental health issues like depression, anxiety, post-traumatic stress disorder, bipolar disorder, etc. And I tried to bring that into the wellness clinic where I'm working in Harrods, and they weren't too keen on it, to be honest with you, initially.
Really? Why is that?
They weren't, because they thought, that's a very medical thing, and
it's a departure from doing skin. Obviously,
yes.
We're now talking about brain health and
yes.
cognitive function.
They were just worried about also it turning into a psychiatric center.
Yes. Okay.
So they were like, it might make things quite complicated because we are still a department store, and yes, we do have a clinic. And we are a wellness clinic, and we do basically tackle different things for longevity. Like, we have cryotherapy chambers, we've got, a podiatrist, we've basically IV fluids, etc. And a dietitian and so on and so forth.
It's that very 360 approach.
It's a 360
already,
approach, yeah,
and this
exactly.
is almost the missing part of it.
Yes, and now this year, BTL Industries released a device which was aimed at treating healthy individuals rather than patients who have psychiatric issues.
Yeah.
Because the effects of TMS are incredible. It's not just
TMS?
Transcranial magnetic stimulation. Mm-hmm. And what it does is it stimulates the left frontal lobe, which is the part of your brain that is responsible for your sleep regulation. And everyone knows that sleep regulation is super important for longevity purposes. When you're sleeping in deep REM sleep, you're giving your body the time to clear all of the toxins that accumulate in your CSF fluid, which is the fluid that surrounds your brain and spinal cord. And if you're wanting to live longer, healthier lives, you need to have good quality sleep. So it helps with improving that aspect of your life. It also helps with mood regulation, which is the part that the TMS was using to improve people's anxiety, depression, and so on.
Which is sort of sky high at the moment.
Exactly.
So it
particularly
seems like
because we're so overstimulated with our phones and social media, etc.
Absolutely.
It helps with your mood regulation. It also helps with your focus and concentration, which is also another element that we're finding people are struggling with, particularly with the overstimulation with our phones. Lots more people are being diagnosed with ADHD. I myself have been diagnosed with ADHD about 20 years ago and have been on medication for it for about 15 years. And I found, after doing TMS on myself, after doing 9 sessions, that it's totally, completely changed my life.
That is amazing, by the way.
Yes.
So you're not taking the medication?
I've stopped taking my medication. Like I said before, taking oral medication can have a profound impact on all different elements of your life.
Yeah, all the
and
systemic
when you're
side
taking
effects.
stimulants to help tackle one thing, it has a knock-on effect on other things. So I honestly, before doing the TMS, haven't had a good night's sleep for a very long time. I'd say the last 15 years I really struggled with insomnia. And even if I was to take melatonin, etc., and other medications, they weren't tackling the issue. And now I can safely say that I go to bed every night and have a really deep, wonderful sleep, and I wake up with no brain fog, and I feel so refreshed, and I feel so excited to tackle on the day.
I think we all need this. I mean, this is like the dream, like whether you're perimenopausal or you've got baby brain or whatever you've got going on.
Yeah.
I mean, I think also for the people who are trying to live their life in a more high performance sort of way, everyone is trying to do so much at the moment. And I think we're all spread so thinly that to have a device that could just keep us a little sharper and sort of on the ball and just functioning in the way that we probably used to function, I don't know, 20 years ago before life sort of exploded and became crazy.
I said to my friends, I feel like I walk down the streets and I have my super brain that I had when I was a teenager. Like I can think really clearly. I've got, I can tackle anything that's thrown at me without feeling anxious. I feel really confident. I honestly haven't felt as happy as I do in a very, very long time. So
that's
I actually think that, as you grow older and you develop and you find yourself and your confidence grows, but this has really added just so much joy to my life. I feel so much happy. I feel like I want to take care of myself. I feel like I can do more, perform better. And like I was saying before, where the longevity, the idea of wanting to live longer and healthier, exercising, using peptides for our bodies to perform better. We're treating our faces to look younger, but no one's thinking about how our brains can match up to that, and so that our brains are able to function as optimally as possible. There's no point in looking younger and living longer if we have dementia, or if we can't focus and perform as we were before. And actually there have been lots of studies that have used where people are using TMS to combat dementia, because it basically it forms different connections in your brain so that you are able to function more optimally.
It's that sort of concept of neuroplasticity, sort of helping the brain to create those new neural pathways.
It creates connections between the basically the neuronal cells in your brain.
Yeah.
And the nice thing about TMS is that the effects of it are cumulative. So the more treatments that you do have, the more you find that your brain functions at a higher level.
Gosh, where do we find this? So this is at Harrods, right?
Harrods, yes. And it's painless. You literally lie down for about 25 minutes. A probe is put on your head and it feels like a little tapping. And you leave feeling really elevated. Your mood is elevated. You feel happy. I have patients and friends who have suffered from bipolar disorder, as well as anxiety, PTSD, OCD, who have had ExoMind whilst they're also doing the other things like taking their medication, because you can do it in combination, as well as doing their psychotherapy, etc., and have found that their progress is so much better. And I also have other friends who have ADHD who have said that they feel that TMS has combated issues that no therapy session ever will.
Goodness.
Because you don't have to sit there and recollect and go over all of that trauma. You're literally, there's a physical reaction and chemical process that happens in your brain without having to take medication. But again, if you are medically, if you're medically prescribed to take a medication, you can still do it in combination.
You still need to do all of this with a consultation of
Absolutely,
a doctor,
100%. This is a medical treatment, but it's also now something that's being offered for the healthy mind. And that's.
But it's interesting you also touched on OCD, because I think there's also a lot of very sort of early studies into this that are saying it's really good with compulsive or addictive behaviours as well. So they're saying things like overeating or undereating. Sort of the OCD, like you mentioned, it might also help us to regain that sense of stability again in life as well, where we've pushed ourselves to the limit, which can also often happen as a result of stress.
I mean, I constantly receive messages from patients. I have one patient in particular who does have OCD and is always worrying about, lots of different medical issues about her son, etc. And she went to the south of France, and her brother-in-law said to her, I've noticed a change in you. They have no idea that she's had exomind. And whatever it is that you're doing, keep doing it, because you're calmer, you think more logically.
Like being on holiday with you
your
so much
decisions
more.
are a lot, you're less emotional with everything, and you don't obsess over certain issues. You're able to let go. And she told me that she actually noticed that, if she's, for example, she finds a lump somewhere, usually she'd sit there and call all her doctors, and she won't be able to sleep. Now she's able to actually talk to herself and say, you know what, it's okay. We'll get it sorted in the morning. And she's able to now live a much more...
She's not catastrophizing everything. Exactly. She's going through those motions in a much more sort of measured way.
Her quality of life has improved greatly as a result of that. And then there are other people who have been smoking for many years, who have had sessions and actually said after they did their session, they were on their way to go buy a packet of cigarettes, and then started thinking, do I really want to do this? And have actually stopped altogether. And have actually made better decisions as a result of having TMS.
God, how interesting. And this is going to lead so well into what Nahid has to speak about as well. But honestly, it's so fascinating that you've sort of integrated a treatment like that into your sort of world of wellness as well. And as you sort of said, Harrods does everything when it comes to do with well-being. But I think
they're all
cognitive function and, sort of understanding where that fits into longevity and also our mental health is something that we all really need to be sort of sharply attuned to. Thank you so much, Marwa.
Thank you.
So our next speaker is Nahid de Belgeonne. She blew my mind the other day when we spoke, because Nahid and I met one another years ago when she was running Good Vibes in Covent Garden, and it was such a great yoga studio. I have such special memories of that place. But I think the way that you're approaching sort of human performance and the way of enabling us to regulate our emotions is so pivotal right now. Maybe Nahid, you could just explain to all of us here how you sort of ended up getting into this place in wellness.
Of course. So I think like many people who are in this space, I came into it because I was looking to fix myself. So I come from quite a volatile family background. Nobody meant that to happen, but my parents were really stressed, and no one had shown them how to self-soothe, so they didn't really know how to pass it on. And the message in my house really was just work hard. So I worked hard and I worked hard and I worked hard, and I didn't really think about how I was feeling. I didn't have that vocabulary when we were growing up. Nobody talked about how they felt. You just got on with things. And that's kind of really fine. It's what you expect young people to do. Youth is on your side, and it feels very dynamic, and that would be my answer to everything. And then, of course, you get to a certain point in your life and things start to fall apart. So I had chronic anxiety when I lived at home, so I couldn't get on the tube. I used to have to walk everywhere because I was convinced there was going to be some awful accident on the tube. I had neuralgia, I had urticaria, which is like a skin rash from stress. And the deciding thing, really, where I just thought I've really got to change things, was where I almost died of a gangrenous appendicitis because I didn't listen to the signals from my body.
I guess you were just going and going and going and just thinking I can work my way through this.
Yeah, my identity was to work hard and build things, and I've worked across 4 different industries, from fashion to publishing to technology to wellness. And they were all startups, and I was rewarded for working hard and kind of completely burning myself out. So I've had several burnouts as well.
And I think a lot of women can probably connect and sort of identify with that as well. You almost don't feel like you're performing unless you are running so hard and you're flat out and you're exhausted, almost to the point where you don't feel like you actually deserve to rest properly unless you're on the ground.
Yes. Well, I think I probably thought, like most people, that resting would make me lose my ambition. and talking about your feelings makes you weak.
Yeah. Well, a good thing that we've come so full circle. Oh, sorry, we're having an issue. You might just have to shout like me. I'm also mic-free.
Because now I emote at every second. Everybody knows exactly how I feel at any given moment. So when I had my studios, I realised that I wasn't the only one. So everybody was all, they were doing all the right things. They were going to yoga classes, we had fitness classes, we had reformers. They were doing all the right things. They were pretending to meditate.
Yeah. That was probably me.
Yeah, it's probably quite a lot of people actually. And they were still angry or stressed, or they had fertility issues, or they, I think we're very good at kind of presenting this shiny front end where we look like we're doing all the right things. We're drinking our green juices, we're taking our supplements, we're going to yoga. We put up that Instagram post of us in a meditation pose. Not meditating. We look like we're doing the right things, but I don't think we are. So I think we're very good at externalizing our wellness, and we leave it to, we kind of think other people can kind of take care of it, because we have such a bad relationship with ourselves. And I think that comes from years and years of marketing, which used to be called propaganda, to make you distrust your feelings. Because if you don't trust your feelings, you're really easy to manipulate and sell product to. And so, even you look at what's going on and what you're being told about what's going on, but what you see with your eyes and feel with your heart are two very different things. And I think that cognitive dissonance is causing everyone to be very ill at ease.
So is this sort of an indication or a reflection also of the patient who comes to see, or the client who comes to see you with your work at the Human Method? I mean, why are people ultimately coming to you?
Well, it's interesting because they come to me with clenched jaws, not being able to sleep, maybe back issues, stress issues. They've burnt out a couple of times and they're about to go back to start a new project or a new job, and they don't want to repeat those patterns. But as I work with them, we slowly unearth things that have happened to them. So one client was sent by his parents to boarding school, and he experienced a lot of racism, but he couldn't tell his parents because they'd spent so much money on his boarding school. So he completely suppressed his emotions, was a real high achiever, went on to do amazing things. But he never spoke about it. And that came out in not being able to sleep, having real anger issues, and feeling very detached from his family.
Yeah.
And he wanted to solve that. He was a trader, and lucky for him, he managed to retire at aged 40. And then he wanted to fix all the problems that striving had kind of built up in his system.
I mean, it's a nice situation to be in where you then have a sort of clean slate to then go back and fix. But for a lot of us, we're trying to fix while still maintaining a work-life balance, still maintaining our normal life.
Well, I think the message that we have is that we have to, especially as mothers or nurturers of women, you have to break yourself to be able to be successful in any way. You must kind of somehow completely work yourself to the bone to make other people, thrive. Absolutely. And feel nurtured. And that's really wrong, and it comes from a society that doesn't really elevate nurturers and care. And I think that's a real shame. So my kind of message is, don't wait until you hit a wall to fix yourself, because that just seems so extreme.
Exactly.
Yeah,
it's cultivating that self-awareness so that you don't burn out and then have to sort of...
Absolutely. Yes, exactly that.
How does the sort of consultation work, or sort of how do you actually work with patients or clients who come to see you? How do you figure out what that individual might need from you? Because you take so many different approaches in your Human Method.
Yes, so they'll fill out a form first of all, so I'll find out about their sort of top line things that they're worried about, and then we'll have a little call, and then we'll talk through that. And then actually the things that they want to see me about aren't actually the things. It was because...
that they put on the questionnaire.
There's so many other things. Where do you learn to not be able to feel anxious if you speak in a meeting? Where do you learn that? You probably learn that because your caregiver used to shout at you and call you an idiot if you got the answer wrong, or maybe a teacher or something like that.
You can always trace it back, can't you?
You can always trace it back, and that stays in your system because we kind of think that we are a cognitive mind with a body, but actually we're a body and the mind is part of that. And your nervous system is your brain, your spinal cord, the communication from that into your organs and body, and back from organs and body into spinal cord and brain. So it's this ongoing conversation that is going on, this signals coming from your body. And when you learn to listen to the ones that are important, because you don't want to listen to all of them, because, you know, put your left foot in front of your right foot, you know, that will take you all day. But actually to be able to really kind of go, oh, okay, I'm really tired, or I'm really angry here. What am I actually angry about? And it isn't the other person, it's because I haven't slept, or I feel a boundary's been crossed, or something like that. So the call will really help to unravel exactly what's going on. And I mean this with great love. I'm actually not interested in people's stories. I'm interested.
In their bodies, in their nervous systems.
Yes, in their nervous system, because how you respond as a baby, you would have responded with your whole self. You wouldn't have thought, Mum's not here. Oh no, where is she? I'm really scared. I know, I'll cry. You just cried.
Yeah.
You're no different now. Yeah. We think we're really sophisticated, and we are, but not in the way that we think we are. You know, your body responds first, way before your brain makes sense of it. So I deal with the body. So when I guide people, they'll be on the floor and I'll guide them, and then I'll be like, that's really interesting. Did you notice, Francesca, I gave you that movement and your breastbone didn't move at all? And that's interesting because your whole system is like a fishing net. And if you've got a pull in one part of it, it's going to influence the whole.
Absolutely. Everything has that knock-on effect, that cascade in the body.
Yeah, and actually it was really interesting hearing the both of you speak, because I think everyone's onto it, aren't they? You know, it's a whole system. And we keep fixing it, if you like, as isolated parts. And that isn't ever going to work.
Well, we sort of paper over the cracks without ever really going to the root cause of it sometimes. And it's so interesting because you keep mentioning going back to sort of, you know, when we're in the, sort of as children and so almost like our primal instincts. And I think we've forgotten a lot of that. And actually the root of a lot of survival and performance and really robust mental health is really sort of locked into those early formative years.
Yes, without a doubt. I always feel really sad when it's September and kids go back to school and people send their young children to school, and I'm like, oh no, it's going to sit down all day and have to follow rules, exactly the opposite of being playful
the discipline
and curious.
Is being instilled at a very young age, isn't it?
Yes.
You spoke a lot about movement. What sort of movement are you integrating, and what do you advocate for? What are the sort of things that we can be doing on the day-to-day when it comes to movement?
So I think one of the most important things to do and to understand is know that cortisol is spikes to make you run, to move you away from danger. Nowadays, all of our dangers are psychological, more or less, right, in the part of the world we live in. So you're sitting there taking, danger upon danger upon danger without doing anything about it, and that's very inflammatory in the system. So the best thing to do is get up and shake it out, move, get it out of your system. Movement actually is very regulatory, and I think we were talking about you being pregnant, and I was like, oh yeah, this and then this, because I'm a bit of a geek with it all. But the very first awareness is movement. So the baby...
Actually, yes, even before babies breathe, they move.
Yes, of course,
in the
they
womb.
move. Yeah. And they start to form an identity that's separate to you by moving with you and moving against you.
Almost like their rebellion or their sort of discipline coming in at that age.
Or their curiosity to understand, I could do this.
And when you say things like shake, is that something that you sort of suggest, that we all shake?
So when you were a baby, you would have been rocked, or you would have rocked yourself if you were upset. You can rock on the floor through your heels. You can get up and just shake it out. Rolling on the floor is really good, because essentially what you're doing is you're feeding in new information through your whole self, through all of your senses, into your brain. And that will completely shift you out of your repeated habitual responses. So if you want to get out of anxiety, if you're feeling really anxious, the things that your brain wants to know or feels very soothed by knowing is, where are you located? Are you on your feet? Are you against a chair? Or, where are you? And so the best thing to do is actually feel your back into the chair, or feel your feet into the floor. A client rang me up recently from Paddington. She was having a huge panic attack. And I was like, get your back against the wall straight away, and I will help talk you down with breath and some other movements.
That's so interesting.
So there's small movements that will get you out of your patterns of movement. So it's not true that emotions are held in the body. They're held in the brain. And you're thinking, all that's in the brain. But what is true is that the patterns of that emotion is held in your body. So in the COVID years, I was seeing lots of people like that, head down, they didn't want to look at anyone. Their chest was kind of really closed down. And what that will do, everyone's kind of doing that now. And what that will do to you is that it tightens the muscles across the chest. And then it makes your breathing really short. So you start breathing up here, and actually your rest and repair nerves travel through the bottom of your lungs. And up here is your action, go, go, go.
Interesting.
Yeah. So if you're going, you're actually going to be hyping your whole system up again. So it's and I think everyone's spoken about this. It's kind of that idea of overclocking your system all of the time.
Yeah.
So not only is it your environment, it's, what's happening internally in your body, it's then your environment will have a huge effect. And then bottom up, which is what I do, which is body to the brain, but also, top down, which is brain to body. So I work with movement at the beginning of the process, which is your brain, to affect the end of your process, which is your muscle.
And where does the breath come in? Because you've spoken about breath work sort of here and there, but is that a very powerful part of this whole sort of program that you've put together?
Yeah, without a doubt. So breath is movement if you're not sitting in a chair being really, really stiff.
Like us now, we need to be
exactly.
rolling our shoulders or something.
You kind of, and I'm going to just do a little bit of a tangent, if I may, on meditation.
Yes, please.
And the reason I think meditation isn't so suited to most people in the culture that we live in is if you think about it. So I'm not saying don't do it. It's a really powerful practice, and I have a 25-year practice. I'm not saying don't do it. But the reason you might find it difficult is that it was devised in monasteries where men live in communities. They don't have children. They cook in community. They clean in community. And they're moving all day long. So that means that their joints are well prepped. Their muscles are well prepped to sit for long hours. And then, of course, it comes from a tradition where there's a lot of discipline. So that enables them to sit for hours and hours. Yeah, absolutely, job done. Look at our lives. Rushing from here, rushing from there, sitting down a lot or staying in this. Sitting, it's by itself isn't the bad thing. It's staying in the same fixed position because you are signaling to your brain that you're in danger. And interestingly,
that's
the laptop sitting, where the back of your neck is truncated, chest is closed in, eyes fixed, that's signaling to your body the freeze response. Yeah, so you're already alarming your system constantly. So back to the breath. So the reason the breath is so great is I just advocate a 6x6 breath. And again, I'm not saying other breaths are wrong, but this gets the two parts of your autonomic nervous system, which is, you might have heard of sympathetic and parasympathetic. Sympathetic is called your stress response. I don't love that word. Parasympathetic is called your repair. But instead of that, because it's very emotive, I think about it as go, 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 and no go, yeah? And then when you need the energy, you can go, 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 and then you can tap into no go. So the 6 seconds in, 6 seconds out will oscillate between those two states. Because I think we get a little bit fixated, as you were saying, Sarah, about the next thing. And I think we're really good at collecting content. I don't think we're very good at embodying it. And the same for collecting products and thinking this must be good and this must be good. This is about embodiment. 6x6 oscillates between those two states of go and no go. And that's what you want. You want to be an organism of oscillation, not a fixed organism.
Yeah, you want to get away from the static, don't you?
Yes.
And it's interesting what you were saying about people being hunched over at their computers and what you saw during COVID as well, with everyone really sort of being quite tight in their chest, because I think posture is such a powerful form of non-verbal communication, and it sort of, it can make us feel a certain way and it can make those around us feel a certain way about us. Is there anything that we can do sort of individually just to create a greater sense of self-confidence just through the way that we stand or hold our bodies?
Yes. So, first of all, bones. Think about moving from your bones rather than muscles. So again, in our the world that we live in, we use muscle to keep us up in gravity. So often it's these muscles up here keeping your shoulders up, but actually your arms want to hang. So if you think about really feeling your feet, the bones of your feet, so rock on the floor first, that recalibrates your bones. Then the muscles and soft tissue comes along for the ride, yeah? And then when you come up to stand, you'll find that all of your bones have been recalibrated. Posture isn't a fixed thing. Get out of the idea of being fixed in any way. It's a dynamic thing, and the series of curves through your spine all have a relationship with each other. And they want to continually be in relationship with each other. So, yeah, don't think about fix. Rock, and then get up, and just see how the bones recalibrate. And once the bones are kind of nicely recalibrated, everything kind of works.
Yeah, it's so true. And what do you think in terms of, a lot of us, I always have this theory, build this sort of protective armor around ourselves, whether that's through our mindset or our set of beliefs, or even the way that we sort of walk and hold our bodies. Is it ever possible to sort of unpick all of that? Because for a lot of us, that is how we've got through life, isn't it? And it's how we've got to these places in the sort of world that we live in. Can we go back?
Yeah, we can go back. So the trick to it is to stay very curious about things. And I think when we chatted earlier on, I was telling you about clients who are a bit older who have maybe had an accident and they needed crutches for a little bit. And then when they lose the crutches and actually physically they're fine, they're still locked in that pattern of behavior, because even though cognitively you can rationalize it and say, yes, I've moved on, actually your pattern through your muscles and soft tissue has retained that trauma, to the body. And so and then what that's going to do is that's going to then limit what you do. So, one client in particular was like, she avoids going up steps, or if there's a theatre with lots of steps, she's like, oh no, not for me. And I'm like, go up the steps, because that's how you're going to train.
To push yourself a little bit sometimes.
To expand your experience. So I think, obviously when you get older, there's some sort of, you lose muscle, you lose collagen, 50%, it's like crikey. You're losing certain things, aren't you? But actually, I think you also get older because you're limiting your experience. And so I have clients from 20 all the way to their 80s, and some of my 80-year-olds are so youthful because they're doing lots of different things.
They're keeping active and busy, and I think you often sadly see it when people come to the end of their professional career. They take retirement, and they've been so energetic and so full of life, and then it's almost like their life force has been taken away.
Or care homes, where they sit down and they're not stimulated at all, and they're not being curious at all. Yeah. And that's a kind of fast train to getting very old indeed.
So I guess that the trick really is to sort of remain curious and keep looking for those opportunities that make us feel bigger, not smaller, and sort of put us back out there in the world.
Yes, absolutely. And I do little tricks like in... my house is very funny, but I go to a door, and instead of... I'm left-handed, but everything else I do on my right. But instead of using my right hand to open the door, I'll sometimes try it with my left hand.
Oh, that's interesting,
and instead of going up the stairs with my left, which I always do, I'll try it with my right. And that just keeps everything switched on and opening up the neurons. So my work is to do with opening up the neural pathways between sensing, thinking, and movement, which is pretty much your identity, right?
Exactly. It all comes full circle.
Yes.
It's such a fascinating approach, and I could speak to you for hours on end about this, but... there will be time to ask Nahid questions as well, or even do a probably one-to-one with her at the end. Maybe no rocking on the floor, though. I don't know if we're dressed for that. But thank you so much, Nahid. That was brilliant. That takes us to the end of this morning's panel discussion. I don't know about all of you here, but I found that so interesting, listening to your different perspectives. And it strikes me that we talk about mental health, and that's such an intangible concept sometimes. And I think that sometimes makes it very hard to figure out where to start. But what I love about listening to each of you is that you've come up with very sort of eloquent but also very practical solutions, whether that's how we cleanse our faces at the end of the day, going deeper than the skin to actually find those technologies that might work and support us, and even the power of movement and what we can do just sat here sort of moving our bodies and breathing in a different way. It's a really sort of interesting way to think about inner strength and what we can do to feel like a more whole version of ourselves. We'll have a little bit of time for questions, like I mentioned. If anyone does need to scoot off back to your Friday, please don't forget to leave your referral cards. We've got goodie bags for everyone with the amazing R&R cream from Sarah Chapman Clinical. Whilst you're thinking of questions as well, we have a very exciting announcement from the Beauty Triangle. Today, we are launching our new e-commerce boutique, the Beauty Triangle Boutique. We're in a soft launch phase for 2 weeks, so we'll be offering everyone 10% off anything that they purchase there. We'll email you at the end with details on how you can take us up on the offer. But otherwise, leave your email address for us if you'd like to know more and you'd like us to sign you up. We're going to be stocking all of the skincare, all of the supplements, and all of the body care that we recommend and that our experts have formulated, created, and ultimately trust. So I hope to see you all looking at some of that soon. Were there any questions from the audience? There was this lady with the navy blue.
I just wanted to add, thank you so much for everyone who is interested in that, and thank you for the presentation. And the endurance which that club have, because I received the email for a long time, was working in a different spheres which is very close to the skincare. And it's very interesting coincidence that it's the first time, and I think that's one of the most interesting panels, and also...
Oh, wow, thank you. Can you leave us a Google review, please?
Put it on a t-shirt.
So I wanted to say that just the last bit, because my hand was broken, my arm, and I started to write with, to do everything because it was not functioning for, I don't know, 6, 7, 8 months.
Oh my
And
goodness.
I had 2 little children, yeah. So, and I was here abroad. So I want to say that that actually works. If you will try to write or do things with another hand, it's just changing how you think and how you understand the world.
Did your brain suddenly sort of fire up at the same time, trying to learn everything on another hand? Gosh,
Brilliant.
how difficult.
Thank you for sharing.
Bless you. This lady here.
I also want to say about the movement, for example, recently I actually fractured my ankle.
Yes.
I got so used to wearing the air casket.
Yes.
The crutches, and even now, a few days ago, I stopped using the crutch. Still, I was, oh my God, I can't do this. I'm still making that.
Yes, yes, yeah.
I'm trying to get used to.
Shall I tell you a really good thing you can do? Get a tennis ball on the floor or a little golf ball or spiky ball. Very slowly roll your foot on that. Yeah, and let your toes be really soft. And that will just help to wake up the sensors in your foot and to wake up the muscles in between the bones of your toes. But do it a lot, but not hard. And then you'll get that movement back again. And just moving around your ankle and reminding yourself that you can use it. And where you're somewhere safe and you feel safe enough to do so, put some weight through it, because again, that creates bone density, which you probably would have lost when you had your foot stroke. I know. Well, I was the same after my appendix. I couldn't move for 3 months, and I was in bed, and so it's kind of like, I've always moved. I don't know who I am anymore. So it takes quite a big shift to then come out of there. But yeah, keep doing it and keep moving, and you'll get it back.
Were there any other questions? Yes, lady in the front.
When we think, because you talk a lot about movement,
Yeah.
when we think about anxiety specifically and the amygdala being the fear center of the brain and
Yeah.
kind of repetitive, I guess, behaviors.
Yes.
So how do you kind of blend, I suppose, the movements that you do with also tackling that side of anxiety, whereby, for example, somebody who's experiencing panic attacks in certain areas or agoraphobia or things like that,
Yeah.
obviously they've kind of, it's a
Yes.
a learned experience,
Yeah.
right, that's kind of stayed in the body. So presumably those two things have to kind of go together.
Yeah, they do. So I was that person. And the thing about anxiety or any learned behavior is that everything that you're doing, you don't mean it, but everything that you're doing, you're training your brain to stay the same. So there's actually a really good Buddhist parable, and it's the 2 arrows of suffering. And the first arrow is the event itself that would have caused the anxiety. And the second arrow is all the stories you make up about it, and that actually is our suffering, right? So the idea is get out of your head and into your body, because your anxiety won't just hit you suddenly, you'll feel it in your body first. And so what I help people to do is kind of really expand their window of tolerance so that they don't go from naught to losing everything, and going into a big attack. They're able to read the signals from their body that tells them, actually, my palms start sweating, or my breath gets really fast. And so going, okay, right here, the intervention is do some shaking, do some rocking, soothe, some touching, some tapping. Slow touch is very regulatory. Do something that will regulate your system. It might also be a signal, get out of whatever situation you're in, because actually it's dangerous. Do you know what I mean? So we'd look at what your physical responses are and get you tapping into how you can identify them way sooner than your anxiety attack. And I'll give you an example. I had one client who used to suffer from non-epileptic seizures every time she was alarmed, because something very traumatic happened to her once upon a time. And we were able to expand her window of tolerance so that after 6 sessions, she had stopped them. She was in her 50s and she wasn't, she'd been in therapy all her life. But after 6 sessions, she was able to identify those signals that she wasn't able to read before, coming from her body, to be able to then intervene and disrupt it. So yeah, get into the body, get embodied, because this is all made up.
Hi.
I wanted to ask Sarah about hard water. And does it actually have adverse effects on my skin, or are people just trying to sell me water?
They're definitely trying to sell you something.
Yeah.
Have you been Googling it, and is it coming up on your algorithm all the time?
We have very hard water in London, right? I often see, funnily enough, when a client moves to London, big problems with their skin while their skin adjusts. So I do think it has an effect, but I think your skin can get used to it. And I think as long as you're using the right sort of antidote in terms of your skincare, I don't think you need to necessarily change your water unless you really want to. I don't know if you've heard anything.
Well, I'm married to a German, and when he sort of was in London, he was always complaining about the hard water. So we did go to the great expense of having sort of water softener system all fitted and filling up with kilos of salt every month. I mean, I let him do that. It's his issue, not mine.
My parents have got it, but it's very difficult to rinse your hair when
exactly.
you've got soft water.
That's so true. You can never get the bubbles out.
Yeah.
But what does hard water actually do to our skin? Would it just sort of dry it and aggravate it, or is it so it's about sort of restoring that skin barrier again?
Yes, it is kind of skin barrier. So what I see is it gets drier and quite often a little bit of redness and inflammation. It's almost like it upsets the barrier, because if you think about the pH, it's just affecting the pH of the skin barrier. So I guess it's something we talked about earlier in terms of support your skin barrier function more using ingredients like ceramides, lipids, taking those kind of omega oils, looking at what you're doing on your skin. If you've got hard water and you think it's bothering you, don't do lots of acids, so you're also sort of playing with the pH of the skin. So it's about sort of making the skin as resilient as it can be.
Sounds like the perfect R&R cream.
That would do it for you.
Go home and use that
It's
and see
cheaper.
if you still need to get the water filter at the end. Yeah, exactly. Were there any other questions? Oh, lady in the pink, purple.
Thank you so much for your openness as well, for your personal experiences. It's actually connected to
It's important, I think, to put that personal human perspective in.
I think going from the water, we get advertisements everywhere we look, and I think something could be from we buy because it's great branding, but actually could we find something elsewhere that we need? Do we need it, and are we actually overdosing ourselves on substance? Spending lots of money. From a hormonal standpoint, I know that a lot of people, myself included, our hormones are all over the place. And
I can relate with that.
from all of you, it's amazing to have everybody here from skin, body and nervous system. From a hormonal standpoint, what is something that can regulate? Because there's so many things that you're told to do and to buy, and you kind of end up just getting overloaded and not doing any of it. And obviously there are these red face mask things that people are doing.
The red light masks, yeah.
Yes, are these things real?
Okay, so 2 questions. Let's start with the red light mask. Maybe Sarah and Marwa, you want to sort of take that one, and then we can talk about hormones.
Yeah, red light therapy is brilliant. Very good for the skin.
I was having huge inflammation in the knee, huge. It's probably because I don't want to make a surgery. And just a red light is really helping 1 month. I was very skeptic, really, because it's too much Instagram influence. Yeah?
I have friends who swear by them every night.
She's working with longevity, Claudia. She's one of the mom of this. I can't pronounce it last name. She's a German last name. And she just gave me the doctor 1 month and really told me the truth.
Well, I guess because you have the at-home version, which is obviously great for the sort of maintenance, you also have a more professional grade LED in your clinic, don't you?
Yeah, we have a medical grade one, so it's super powerful. I mean, you can feel the energy from it, and it's so bright. I would say for home devices, do your research, because they really vary in terms of the quality and intensity, and you could be buying something that does nothing. And I think that's where there is this doubt over red light therapy. It is super powerful, it is brilliant, but I think there are so many devices, and you can see it across the broad spectrum of price range, is to just do research and look at reviews. I'll just hand over in case you've got something.
No, I totally agree. I think the devices that you have in clinic are, first of all, the size of it is monstrous. They're massive. Second of all, in order to be able to use those devices, even as a medical professional, you need to be trained to use those devices, and you need to use this eyewear, etc. So if you have these devices that are super powerful, they're never going to be, so the home devices will never ever match up to the ones that you have in clinic. They're definitely in a different league of its own. And the home devices that I have found that do make a difference are the Dermalux Flex. I think the Dermalux Flex, it's a good thing to use at home in combination with the treatments that you have in clinic, because the equivalence is like about 5% of what you would be having in clinic. So like you said, definitely most of the devices are nonsense that are over the counter. They'll never ever match up to the strength that you'll get. But yeah, red light is definitely an incredible component to skincare. It's anti-inflammatory. It also helps with reducing inflammation in joints, like this lovely lady who has just mentioned, but also helps with hair growth. So if you have hair loss, red light is definitely something that will help you. We use red light. In clinic, I use the Dermalux MD, which is also used in hospitals. And at home, the Dermalux Flex is a great
and the Flex, you can obviously sort of mold it so
exactly.
it can go over your face. Can you lie
use
on
it?
The
body?
Yes, on body parts.
Do you also have the Dermalux?
You should use it on your ankle.
I definitely think it's the strongest out there, and but it's a mighty big machine to have at home, which I don't think anyone would ever do that. But the small one that goes all the way around can be used at home in between treatments.
That's really helpful. We might have to take your hormone conversation offline just because I'm getting the timeout signal to. I think they're serving lunch very soon by the sounds of it. We've chatted for a bit. But a big thank you firstly to everyone in the audience who came. It's been amazing to have you with us and to see so many faces, new and old. Thank you for joining, and come back and see us at more events. There's information on the back of your programs about our Beauty Triangle Festival, which is happening on the 24th of January, so save the date. And we've just launched some VIP tickets, which sell very fast, so just putting that out there. A big thank you to the Sloan Club for hosting us so beautifully. It's the most gorgeous new space you've created here, and we will definitely be back. We love it. And finally, a big thank you to our Beauty Triangle for your insights and just being fabulous company this morning. Thank you.